Hello, my name is Jason Howe. I'm the current board president of the National Alliance for Recovery Residences, or NARR. Welcome today. We'll be doing an overview of NARR's recovery residence standards. So NARR, as I mentioned, it stands for the National Alliance for Recovery Residences. We are a 501c3 nonprofit, and we're peer-led. We were founded in 2011 and merged with AHAP in 2013. AHAP stands for the American Halfway House and Alcoholic Programs. I'm sorry, the Association of Halfway House and Alcoholic Programs. Our mission is to promote addiction recovery through the use of recovery residences. And what we're most known for is developing a national standard for all recovery residences and really creating this philosophical framework that includes the range and the spectrum of recovery housing choices that exist across the United States. We accredit state organizations that we call affiliates to certify recovery residences within their respective territories. So oftentimes people ask, why a national standard? The standardized nomenclature really allows for more productive and meaningful conversation, and it allows us to have conversations across the United States, translating across state lines. And this is really important because different states have different laws, and those laws change over time. So what organically can grow from a recovery housing standpoint in different states can look different from state to state. So we needed a standardized way of talking about recovery residences, whether we're talking about recovery housing in Florida or Texas or California or the Midwest. And we looked across the U.S. and found that there's really 4 different types, or what we call levels of support. And that's this inclusive framework. Everybody's at the table. Not one is better than another. They're just different. And we get to match individuals' needs with the appropriate level of support. It also kind of unites this fragmented industry, this fragmented knowledge base that's existed for over 170 years. Recovery residences have been in existence since the mid-1800s. A standard facilitates the collection and promotion of best practices. Researchers love it because it equips them with more comparative subjects to study, and it's a basis for a certification program. So looking at the certification program, it is a public-facing mechanism that really empowers choices. And these are customer choices, funder choices, referral agency choices. It provides a consumer protection mechanism, and we offer a grievance process that people can engage in. It promotes quality and provides oversight without raising impediments to fair housing. Persons in recovery like myself meet the definition of disabled, and as such are a protected class. And so when local and state entities, government entities try to regulate our housing, it actually raises barriers to our fair housing choice. So a certification program is a way to incentivize and distinguish quality, but without raising impediments. NARR is also all about carrots over sticks. We're about incentivizing best practices rather than policing compliance. And a certification program, it's a complement to existing regulation. We don't want to replace the regulations that's out there and that's needed, but it's a complement to that. Certification is also very cost effective, and it's flexible over time. So looking at, how was the NARR standard developed? Really in 2010, there were several thought leaders that kept running into each other at various regional conferences and talking about that we needed to have a national organization. And so we started getting together and having conference calls on a weekly basis. There were some pre-existing organizations and emerging recovery resident organizations that each submitted their respective standards. A lot of them had recovery resident standards in place. And this gave us the opportunity to kind of collate, look at, so where's the overlap, and then where are the differences? Where are some standards that were showing up in one particular region and not another, and why? I think something that really important and a key to our success is that in May of 2011, a lot of us got together in Atlanta, Marietta, Georgia, to really look at the draft set of standards. And we had representatives from 15 different states and several different national recovery organizations, including AHAP and Faces and Voices. And we developed consensus. So it wasn't necessarily a democratic thumbs up, thumbs down process. We really had conversations around each and every standard that was proposed, and we developed consensus around that first draft. And I think it's because we developed that social capital with each other. We really trusted each other and knew that we were all coming from the right place, that enabled us to have some really tough conversations over the next couple of months, because between May and September, we went through each standard and really kind of philosophically talked about why one should be included or not included. And in September, we launched this historic document, which is the national standard for recovery residences. And that process continues. The NARR has several committees, one being the Standards Committee, and that committee is responsible for reviewing the standards periodically. Our next version of the standards should be coming out around April of 2015. Definitely want to give our props to our predecessors, looking back at the organization, standards, and certifications that have been developed over time. As I mentioned, recovery housing first is in the history books in the mid 1800s. And then it's in the mid 1900s that we see providers coming together and organizing around best practices. And the first is the Association of Halfway House and Alcoholism Programs, and their focus was really around workforce development. Their training was around the workforce of individuals that were living and working within the recovery residence, and that is reflected in their certification program. We look into the late 1900s and the early 2000s, and this is when regional organizations started looking at, so how can we develop standards for the program, for the residences themselves, and develop training and certification programs around that. And of course, we've already talked about NARR's development in 2011, and kind of pulling all that together and unifying everyone across the United States. So looking at the NARR standard, version 2011, it can be broken down into 6 primary domains, and there are 45 items in total across those different domains. And you can see them listed there underneath the 4 levels of support. So on this slide, you notice that there's little houses across the top with Roman numerals 1 through 4. That represents the 4 levels of support, or the 4 types of recovery residences that you see across the United States. And then underneath that are the 6 domains. So as we get into the standards, you'll start seeing that some of the levels of support have different standards than others, and then some of the standards are important across all levels of support. So first up, let's look at domain 1. That's the organizational administrative domain. And you can see that there's quite a few important things that are applied across all levels. All levels of recovery residences require a mission and vision, a code of ethics, be legally compliant, have a clear organizational chart, provide a safe workplace, such as a drug-free workplace. And then oftentimes recovery residences don't own the property that they're operating out of. They're leasing it from someone. So in those cases, it's important, or a requirement, that the owner of the property is aware, it gives permission that a recovery residence program can be operated out of that particular property. Then we get into a couple of the standards, the house being, the program being a legal entity, such as a corporation or an LLC, having the appropriate liability insurance and collecting data. That's a requirement of the higher levels of support, specifically level 3s and 4s. NARR, as you notice with the asterisks, we strongly recommend these things for lower levels of support, but they're not required as per the standard. And then the last one, having clear job descriptions and employee contracts, that is a requirement of level 3s and level 4s. Next is the fiscal domain or financial domain. Very simple, an accounting system. And this is important across all the levels of support. So it doesn't have to be a software accounting system. It can be a paper system. But the important thing is, does the provider have the ability to track accounts payable, accounts receivable, generate invoices, accurately account for the cash flow and what a particular resident owes or gets their deposit back, etc. Domain 3 is the operational domain, and a lot of times people ask us why we split 3.1 and 3.2, and really it's looking at the I don't know if the complexity or the formality of the emergency protocols. And so with the lower levels of support being level 1 and level 2, definitely we're looking for emergency procedures and having those emergency contacts posted within the house that makes it easy for residents to kind of orientate themselves and kind of have that emergency plan. But once we get into level 3s and 4s, that's just a much more sophisticated and formalized system. You've got employee manuals, you've got things that are really outlined from an emergency protocol standpoint, and you start seeing evacuation maps within the residences that can help guide individuals out. 4.0 is the recovery domain, and this is a really beefy domain within the NARR standards. There's lots here. So one of the things I tried to do was break this down into subsections so we can get our heads around it. So the two main subsections are services and then staffing and governance. And so this is a key way of distinguishing between the different levels of support is the types of services that they're provided. So as you look from left to right underneath the levels of support, you'll notice that there are certain types of services that are found and required across all levels of support, namely safe and supportive housing, and then the social model philosophy, social model of recovery. And then as we start going up the levels of support, you start seeing more robust, more sophisticated recovery support services being delivered. You start seeing life skills being delivered in 3s and 4s, and then in 4s you start seeing clinical services. So this is interesting. People often ask, so if clinical services are provided in level 4s, isn't that licensed treatment? And you're absolutely right. So remember, we created a very inclusive framework and philosophy around recovery housing. And so licensed inpatient treatment could be utilizing the social model recovery and really be utilizing peers to a high degree and meet NARR standards. In most states, levels 1, 2, and 3 are not, they don't provide licensable services and thus are not licensed by the state. Let's go ahead and take a deeper look at services. So first up is the group of standards that are related to a safe and supportive housing. You can see this is important across all levels of support. We developed recovery residences specifically for a population in mind. That's the priority population. And so developing a screening protocol that helps make sure that we're matching the right individual with the right level of support and the right recovery residence. Other policies, privacy policy, making sure that their records are secured, that there's a grievancy process in place, and that there are written resident rights, requirements, and house rules, and that those are communicated to prospective residents during an orientation process. So before anyone signs any resident agreement, they have clear understanding of what their rights are, what the requirements are, and what the house rules are. So a lot of times I get the question of, so what is the type of resident agreements that we typically see across recovery residences? And that can range. So there's 3 general ones that I can think of. First is a standard residential lease with an addendum. Another type of agreement that I've seen is really more around delivery of program services. So individuals may not be paying rent like in the first example, but they're paying a program fee. And then the third example is, especially in level 1s where groups of individuals live together as a family, a democratically run family, they can create a membership organization, and housemates become members of the house, and so that resident agreement can look like a membership agreement. So there's different ways of looking at or establishing a resident agreement. NARR doesn't prefer one over the other. We just require that one exists. And then also policies and procedures that look at specifically at drug screening, relapses, readmission for various reasons, as well as the types of substances that can be brought into the home, and that's both over-the-counter substances as well as prescriptions, and then policies around med management, storing of meds, etc. So the next group of standards can fit underneath this concept of social model recovery or social model recovery philosophy. This is the cultural, social, and interpersonal aspects of recovery. So when we're thinking about a recovery residence, is how do we create this healthy, vibrant, peer-supportive culture within the brick and mortar? And so some of the elements that we have here and that are important across all levels of support is fostering mutual aid, and that can look like peer-based interactions, house meetings, community gatherings, social activities. These are the types of things that you see regularly scheduled in all types of recovery residences. To what degree is recovery seen a part of an individual's journey, the resident's journey? It's their recovery. And so how is person-driven recovery encouraged and fostered within recovery residents? Also, is it community oriented? And a lot of times we talk about the community within a recovery residence. This particular standard talks about the community outside of the residence and how can we inform residents and connect residents with those community-based resources. And that could be resources within the greater recovery community and or beyond, just in the greater community. And then 4.13 is specifically looking at the recovery, greater recovery community, all the different wonderful mutual aid societies that are available. They could be 12-step oriented, AA, NA, etc. And then there are others like Celebrate Recovery and Smart Recovery. It's important to get individuals living in the house connected with that recovery community outside of those four walls. And it may also look like inviting the outer recovery community into the house. So it's seamless and all part of the network. Next, we can look at recovery support services, and the 4.12, you find recovery support services across all the different levels of support, but because you have different staffing as you go up the levels of support, what recovery services look like or how they manifest in a particular level of support can be different. So, for example, in level 1s and 2s, that's level 1s, that's where you have a group of people living together, supporting each other in recovery, so very much mutual aid. It's a democratic process where somebody is a voted house president or house treasurer, and so you definitely see recovery support, but it's mutual aid. Level 2, you have a designated house manager, so that house manager could also be providing some mutual aid and then also encouraging support amongst the residents. Once we get into level 3s and 4s, this is where you start seeing trained and supervised staff. We could be talking about certified recovery coaches or certified peer specialists that could be trained in motivational interviewing or WRAP, wellness recovery action planning. There's any number of types of services that could be peer delivered in levels 3s and 4s. And then 4.14, the didactic recovery support. These are structured, regularly scheduled, curriculum-based recovery support services. And those are found in the higher levels of support, meaning levels 3s and 4s. Then we get to life skills development. So you see that that's not required in the lower levels, levels 1s and 2s, but once we get into 3s and 4s, it is required. And I just listed various types of life skills that could a particular residents could be using, and the types of life skills classes that are being provided really are based on the particular priority population. What does that priority population generally need? So a house that is really focused in on men that are coming out of chronic homelessness, those life skills development may look different than, say, women and children that are coming out of a specialty docket or a family court docket. And finally, in this section, or in the services part of this section, we see clinical services. That's required with level 4. And of course, state laws differ, and so the clinical services provided need to be provided in accordance with the respective state laws. And finally, within this recovery domain, we look at the staffing and governance. As we get into the higher levels of support, that's where we saw all types of services being provided, lots of wraparound services. And so you really need a staffing plan. You need, how are you going to be able to deliver those types of services and have supervised staff? If we're talking about level threes, that's all, it's the programming is all non-clinical. Once you get into fours, it's a combination of peer-delivered services as well as clinician-delivered services. And so what does the staffing plan look like around that? The next domain is the property domain. And so you can see there's a long laundry list and things that you would want to see. And this is true across all levels of support, from upholding fire and safety codes, making sure that every individual has food and personal storage that's available to them, working fire extinguishers, working smoke alarms, and when appropriate, CO2 detectors. That a non-smoking living environment is created. So typically we look for, so where's the designated smoking area outside of the home? One of the things that we really keep an eye on is the square footage in sleeping rooms. We want to be seeing at least 50 square feet per person per room, or per bed per room. NARR is the ratio of number of say sinks, toilets, and showers to persons is 1 to 6. So for every sink that you have, there should be no more than 6 individuals living in the home. Access to laundry services. These recovery residences really are blending in. When they're done right, they completely blend into family neighborhoods. And so we want to make sure that it's the recovery residence is compatible with the neighborhood that it's in. We talked a lot earlier about the social model of recovery and the importance of fellowship and community interaction. And so architecturally, we need to see that from a property standard. So making sure that there's adequate community meeting space, square footage dedicated to community space is very important. And then, of course, working appliances and timely repairs. And the sixth and final domain is around being a good neighbor, because we all want to be good neighbors, especially with a lot of the fair housing issues that we have come from what they call NIMBYs, which is not in my backyard. And it's really neighbors that, based on unfounded fears and just stigma, sometimes get upset that we're running a recovery residence in their neighborhood. And that generally happens initially, and then after they get to know us and realize that we're not loud, obnoxious, parking in their parking spots, we end up becoming favored neighbors. And so that's what the good neighbor policy and standards are about. 6.1 is about being responsive to information inquiries and responsive to any complaints, even if the complaints are not resolvable. We definitely need to be responsive to those complaints. Parking is always kind of a sticky issue, and so having a parking plan and even creating some parking courtesy rules are important across all levels of support. And then something that is strongly recommended in levels 1 and 2, but definitely required in levels 3s and 4s, is looking at nuisance prevention rules. That's kind of how I sum that up. Is so what's the policies around noise, just being aware of not playing your loud radio right next to your neighbor's yard, not smoking right there on the property line, not loitering in front of the neighbor's property. It's all about being a good neighbor. And a lot of times it's about teaching our residents how to be a good neighbor, how to be considerate. So those are the NARR standards. As I mentioned earlier, they are periodically reviewed so we can add to the knowledge base. The new version of the standards should be coming out in around April of 2015. We don't foresee any major changes. It's really just kind of adding to the knowledge base, providing more clarification between the different levels of support. And we're always looking to grow our knowledge base. Something that I would like to add here is, once we look at the unification of recovery residences across the United States, creating standards, creating a standard language, making room for everybody at the table with this philosophical framework, and then ensuring quality with the certification program, empowering people's choices. There's some opportunities at the federal level that can result out of this. If we can get recovery residences recognized as valid, if not vital, housing choices for persons with substance use, this opens up all types of conversations that are happening at the local and state level that, in recent history, we've really been excluded from or marginalized at. And it's difficult to have these conversations if we don't have that political cover coming from the top down. So that's one thing that NARR would really like to see. Also, how can we lower policy barriers for persons who choose recovery housing? So if you have an individual who's choosing an absence-based approach to recovery or recovery in general, and they're choosing to live in a sober, safe, and peer-supportive environment, why wouldn't we want to give them access to that or empower that choice? And so sometimes these policy barriers can look like funding barriers, and we need to address those. But sometimes it's around fair housing barriers. And that's what the next point's about. So how can we better protect fair housing rights for persons in recovery? We're catching a lot of heat out here and across the United States. That's our biggest barrier is fair housing. So let's educate the existing grantees, those that have been receiving funds through the Fair Housing Initiative programs and the Fair Housing Assistance programs, to recognize and respond to fair housing impediments that people in recovery are facing, and or let's fund peer recovery organizations to do the education, to do the enforcement around fair housing issues so that we can protect ourselves. And currently, the Department of Justice and HUD have a joint statement around group housing and fair housing. But what we found is that city attorneys poke holes all through it. You would think that it was clear enough in the writing, and I'm sure that the authors thought it was clear enough in how they wrote it, but we need that joint statement updated, clarified, and specifically identifying that people in recovery meet the definition of disabled, are a protected class, and have fair housing rights. Because if housing's a right and recovery's a right, then recovery housing's a right. Thank you so much for tuning in and listening about NARR's standards. For more information, you can go to our website, which is narronline.org. That's www.narr